public health emergencies such as COVID-19 present various challenges such as misuse and misallocation of funds. As Zimbabwe, we have lessons that have been derived from government's response towards COVID-19. When there are no systems to deal with emergencies, there will be leakages that allow the misuse of public funds, and public funds can be misused to the benefit of partisan, group, or individual interests. Following the outbreak of COVID-19 pandemic, Zimbabwe received a huge amount, which was meant to improve the healthcare sector during COVID-19. The easing of some controls and the streamlining of processes and procedures to facilitate emergency responses and quick actions to the crisis exposed government to the possible risk of misuse or abuse of public resources. The urgent need to acquire critical items during the national lockdown period caused management to at times overlook some of the procurement regulation requirements. This resulted in some tenders being fast-tracked, and the intended objectives of the publicly funded COVID-19 intervention may not have been achieved, but it only benefited a few who are politically connected. The Parliament of Zimbabwe, through the Public Accounts Committee, tabled a report that shows that allowances meant for food-insecure households, disabled people, the elderly, and child-headed families were not received by the beneficiaries due to various reasons. These included duplicate payments and disbursements of funds to people with fictitious names. Some government officials received COVID-19 relief disbursements they might not have been entitled. Some disbursements were done without evidence of a pre-assessment suitability being done. There were anomalies in the management of quarantine centers where the procurement process for food and other provisions were not supported by the approved requisitions from the centers. Equally missing was lack of evidence of reconciliations of the cost of goods and services paid for by the Ministry of Public Service, Labour and Social Welfare Head Office with the actual goods and services received by each quarantine center. Procurement of goods and services by some entities were in violation of procurement regulations and done in the absence of procurement plans. Transparency International Zimbabwe also did research on the use of COVID-19 funds and found some of the anomalies, which include manipulating the procurement process by granting tenders to politically connected persons who will not deliver the goods and services. Discrepancies between donations that were reported by the media and the government. Theft of essential medicines and subsequent diversion to grey markets, bribery, nepotism, favoritism, and false referrals. Inflating prices of goods and services so that public funds are used for personal gains. How can this be dealt with? We need to strengthen institutions like the Procurement Regulatory Authority of Zimbabwe to be accountable to government, parliament, CSOs, and citizens. Whistleblowers should be protected at all times. We should enact strict anti-corruption policies specific to the public procurement system, which punish those found guilty of corruption practices. Due diligences should be taken in all public procurement processes and follow the tenets of public procurement, which are transparency, integrity, economy, openness, fairness, competition, and accountability. Government should adopt an e-procurement system which is promoted as a mechanism to institutionalize transparency, accountability, and integrity in public procurement. Parliament should make effective use of an inexhaustive set of tools at its disposal to deliver on its oversight role on public health. Now that's transparency and accountability to the public.
Transparency International Zimbabwe, a coalition against corruption.